Okay, Layla. Now, we did the surgery with you. We did the nose correction, cat eyes, brow lift, mid-facelift, Adam apple shaving, and the breast augmentation.
And bisectomy.
And the back of
Buccal yeah.
How was it? How did you have a lot of pain, or was it okay?
To be honest, I was really scared at first because I'm doing breast augmentation, my full face at the same time on the same surgery, same day, so I was a little bit scared. But actually it was so easy and so fast. I just felt like I was sleeping. I wake up and I felt just cold. But after that, the pain was not so hard. So I'm very happy about it.
Okay. You came alone. So is it okay to do this surgery alone?
Honestly, a lot of people told me you're crazy to go alone. But I felt strong enough to do it. And actually it's possible to come alone. The nurse is always there for you at the hospital, and after when you go to the hotel, she comes visit you all the time, and the team is always there also, so I didn't feel alone at all.
Okay.
Of course, at night you have special nurse, at daytime you have special nurse for yourself, and at hotel, of course, you have follow-up nurse.
And of course, a lot of people are asking, is it Turkey gay-friendly or trans-friendly? What was your feeling about that?
Absolutely, I'm a lover of Turkey before doing surgery here, and I felt very safe, even if I go out alone, or today I went shopping, for example, and everyone was very friendly to me, so it's very LGBTQ friendly.
Okay, great. Now let's talk about some technical issues about the surgery. So we did the Adam's apple shaving. Doctor, can you tell us more about this surgery?
Actually, these are very complex surgeries and very specialized surgeries that they should be done by experienced surgeons. And people actually, they don't know about it, these surgeries, and because we can share it on Instagram or social media or Google, and actually these types of surgeries really very frequently, and we can combine them. Actually, this very complex surgery with too much surgeries, and it takes only 2 hours and 50 minutes.
Yeah.
And this operation time is really very important for me because after 4 hours, blood embolism risk increases very highly. So short time is really important for me, and my team is really very experienced. And I do surgeries really very rapidly. I start from bottom to up, and actually this happened.
Yeah.
I start with breast implant surgeries. In trans surgeries, I always put them in dual plane type 1, and it takes about 15 minutes. And I moved up, so we did an Adam apple shaving, and actually people really don't know about it, and it's really very an easy surgery for an experienced surgeon because we do very frequently face and neck lifts, and I also do tumor excisions and other things, reconstructive surgeries. So this anatomy is really very important. If you know this type of surgeries, it's really very easy, but if you are not experienced about it, you can have really very botched results. And for Layla, we did it, and I shaved it about 2 centimeters. There is no injury to her vocal cords or any other nerves. Now, already it's really very swollen, it's really very feminine, very natural results. And her scar is really faded in her crease between her neck and the other areas. So there will be no scar visible, and it's really very small, 2 centimeters long.
Yeah.
We can do these surgeries very safely, and we can have very nice results. There will be no scar will be visible, and all of the advanced one was gone. And then we moved to her nose. It was a crooked nose. She had a trauma before. Most probably, even she doesn't remember.
It can also during the baby time.
Yes,
I think so.
Yeah.
It was all deviated and she couldn't breathe. although she doesn't know, and I fixed her breathing issues. I fixed her shape. I put new grafts her face, so it's really very solid. Because in the previous one, before the surgery, it was so weak and it was really hard to breathe. I fixed all breathing issues and other things. And for her face, I did a brow lift, lateral brow lift. I did a cat eyes and mid-face. Not full face, mid-face, but I moved all of these tissues up. She has only a little scar in here, about 2.5 centimeters. It's all in hairline. There is no scar on her face. So there will be no evidence of surgery in the future. About 1 year later, she will have no scar, because when hair growth happens again, she will have no scar, she will have brow lifted, she will have a nice tilted eyes and mid-face lifted. But we did a bichectomy. Also, I rest on you because it will be so shadow. I removed partially her buccal fats. We removed about 3 cc from each side. Even now it's very swollen. She has a nice cheekbones and jawline.
Yeah.
About 2-3 months later, these swellings will be gone, so skin will be stretched. And it will be more prominent that she has a cheekbones and jawline. Because for the breast, most of surgeons prefer to put about 300 cc for starting, but we have so much experience with the trans patients.
So this is what you put in?
Yes, this is 500 cc. We used a mentor for her, 500 cc. And this is the size that we put in. We put it under the muscle in upper part and under her breast gland lower part. Her scar is really very hidden in her crease. So in the future she will have no evidence of surgery.
But now she is very swollen. It takes about the nose. It takes about 1 year, and the rest.
For full recovery, she needs 1 year. But her skin is very not so thick. And she doesn't have so much swelling, but I already told her that after she removed her bandage, she will have a swelling on her nose, on her face, and we gave her materials to put on them. But 2-3 months later, she will start to see the results, very nice results, very shaped results. But full recovery can take up to 1 year.
Okay. A lot of patients are asking for FFS. But I think every person is different.
Yes.
Of course. Yeah.
Yeah.
So
they should be referring us with their medical results and about their pictures. We can also do other things for them, because we can do shavings, endoscopic shavings without any cuts from here all the way, small cuts. But of course, in some patients, we also need this cut to lower hairline and make bigger reductions in these bones. But without any scar, with endoscopic surgeries, endoscopic facial surgeries, we can make really nice results like this.
So if patients are applying for it, they have to send everything. So
yes.
Every patient
they should be also honest, because sometimes we some patients that they are hiding some drugs that they are using. They also hide surgeries they had them. We see them, okay, you had them, but of course you can hide them. But we can have nice result if they are honest.
Yeah.
And we will be also honest for them, because we won't tell them any more surgeries that they can have.
Of course.
Yeah.
We will be also honest. They should be honest.
Yeah. And Layla, what kind of surgeries do you want in the future?
In the future, I would like to have perfect Barbie body. So tiny waist, hips, and bigger volume in my ass.
Yes.
So that means what kind of program you have to make for Layla?
For Layla, we already talked about them. I can make very nice waistline. I can make her muscles, 2 packs visible. We can make J+1 for tightening her skin in her arm crease, in her waistline, inner thighs, and I can also use these fats for projection of her hip dips. But since she doesn't have enough fat to increase her projection of her butt, we should be using implants, gluteal butt implants. You will have about 5 cm scars on your gluteal crease. And these are butt implants. They are very solid. They are small in volume, but they give very nice projection in the butt. It's, for example, 300 cc's. I have patients 300 cc's, 400 cc's, and they give very nice projection. We talked with Layla, and she says it's very small.
It looks very small.
If we go more than 500 cc's, because we can have complications, we don't want any complications.
Of course not.
A lot of patients are asking very embarrassing question.
Yeah.
If you have butt implants, when can you have sex?
6 weeks are our limits, because the body heals by itself in about 6 weeks. So after 6 weeks you can have sex, you can sit on your butt, and you can do other things. But you should be careful in that time period. 6 weeks is important.
And I had another question about
when
you make butt implants, I think you should stay, for example, in Istanbul a longer time.
No, actually 1 week is already enough.
Also,
because we always see it. If your scar is good, if everything is good, your blood levels are good, okay, we make your checkups, and we say if you don't have any problems, we let you go.
But you cannot travel by plane sitting. You
can sit.
You can sit? Oh, cool.
With pillow.
Yeah.
You get your BBL pillow, and then you can sit on your upper legs, and no pressure on your butt.
I didn't know that. Cool.
You put it under your thighs, so your butt is free, and you can sit on them.
Cool.
The only thing with butt implants is to have a personal hygienic, very important.
Yes.
So after every toilet visit, you have to clean it very carefully.
Of course.
And sometimes you have some small openings, and we give you some product to use it. And after arm lifts, thigh lifts, we always see it in the crease lines, because there is always sheathing between them, and you have to keep them clean. And some results, some patients, they are saying, I am really very scared. Okay, I understand you. Please use them and don't be scared. It will be okay. And after 2 weeks, there is nothing.
Good.
Do you have any other questions?
No, I think all my questions are answered.
Okay.
Thank you.
We will be always ready to answer your questions.
Yeah.
You can ask Zubi, she will direct them to us, and we will always with you.
Perfect. Thank you so much.
You're
Thank you.
welcome.
Welcome.
Have a nice recovery.
Thank you so much.
We will waiting you for photos.